Thank you. I sat there and thought about my baby. Is my baby beautiful? Is my baby ugly? So I'm going to think about how I put a bow on this baby. Thank you. Great. Very good. So as Dr. Ramirez, and thank you for that overview, that sets the stage very well, because as we start the journey of clinical research, every journey we know starts with the first step. And the first step in our approach to clinical research always starts with, what is the question that I want to ask? How am I going to develop that question? How am I going to bring some sense of solidity to this cloud as I'm thinking about my research idea, and then begin to go through the considerations of how do I move from an idea that I have or an area of interest that I have for research, and then move that to the point so I can actually perform that study and then end with some results that are going to be worth sharing, again, worth publishing and disseminating. So in our short time together, I'm going to talk about what some of the sources might be, where you might go for some ideas for your research question. And then I'll move to a bit about, well, how do you know what the characteristics are of a good research question? How do you pull that information together and then apply it and then come up with something that is going to be worth answering? And then what are the format? How do we describe and how do we put our research question into a format so that we can pass it along to our librarian if we're going to get some help from the librarians for literature reviews, or if we're going to be really then dissecting the elements of that question, we have to have some sense of organization to our approach. So as we are thinking about where we start this journey, it always starts with, well, what is our area of interest? Where do we have the skill or the expertise? Where can we begin to get some thoughts regarding gaps that exist in the literature or areas of a particular field of study that are worth exploring further? So generally, our sources of questions are from something that we have done previously. We may have performed a study previously, or participated in a study previously, or been part of a group discussion about research. And that helps us then begin to give a little bit deeper consideration. And then we begin to generate our own thoughts about, well, what would happen if we did this, or how we can then imagine an alternative approach or an additional approach. We might also look at the literature for a source of question. We may be looking at and reading about certain areas of clinical practice or quality improvement or diagnosis or treatment. And in reading the literature, always at the end where Dr. Ramirez was talking about, we're getting to the so what, to the very end of the discussion portion. Oftentimes in the discussion, the author or authors will be talking about future studies or areas that were not explored, or areas that cause some additional consideration for their study. So reading the literature may help you then identify areas for your own questions. You may also attend meetings. This may be a conference that you go to. You're there learning about new aspects of clinical practice or patient care, or a performance in some area of healthcare. And when you are there, you may be at a session where you begin to have additional information, or that prompts some thoughts about how you might then expand your perspective regarding your particular area of interest or specialty. Oftentimes when you attend a meeting, though, it seems like over time, as you have more experience in an area, when you go to a meeting, there might be 5% of that meeting is actually new knowledge for you. Instead, you're spending a lot of time networking with colleagues or others, so you can get together to say, I want to talk with all of the people at this meeting that have an interest in the same area that I do about a particular topic. So you pull together and use those social opportunities to get with friends and other colleagues, and then you can share information about what their experiences were. And through those types of conversations, then you have an additional idea or a different perspective about your area of interest. And then certainly anytime, those of us that are in healthcare, we do a lot of interaction with our patients. So just the actual engagement of patients, the patient care, the conversations that we have with our patients, our families, the conversations that we have with other members on the healthcare team may also be a source of questions. So you can see that there are many opportunities for us to expand our inquiry, to expand the depth of our appreciation for knowledge and all of the many areas of healthcare that are still unexplored. I know when I first started working with Dr. Ramirez a couple of years ago, he reminded me that, everything that we know about healthcare is this big. Everything there is to know about healthcare is this big, much wider. So there are plenty of opportunities for questions. We just have to have an organized approach. So we'll have questions then that are generated by the healthcare worker during patient care. Again, this may be our interactions between each other. This may be the things that we have noticed with patients. This may be questions that come up as part of care, or we may have questions that are generated by the patient themselves. The discussion that you have with your patient may ask you questions. And you think, that's something that's really good to consider. We don't have a lot of evidence, or I haven't, thought of that. So our patients themselves can provide us with information that may be important for us in our question generation. Generally, when we think about establishing a research question, it's going to coalesce into several different areas, but these are something that I think helps us to really consider how we would organize our thought processes for our research areas of interest. We may be generating a question regarding a diagnosis. It may be how to diagnose, or it may be a question that emerged from a process of diagnosis. We may have questions that involve treatment, maybe the effectiveness of treatment in real world, what is happening in response to treatment, or we may have questions about gaps that exist in providing treatment for specific areas of disease or particular patient-related issues. We may have questions that deal with a prognosis. How well is a patient going to do? How do we influence how well a patient is going to do? How well the patient is able to deal with a prognosis? So then you get into other aspects beyond the actual clinical care of that disease, and it may be social, it may be mental health, it may be behavioral. So many different aspects that deal with how a patient is dealing with a prognosis. And then clearly, many of us are living in this time with, as we've gone through with COVID, that we're spending a lot of time looking upstream. How do we prevent disease? And what is involved in disease prevention? So is it medication? Is it behavior change? What are the many aspects that we can do that will keep the disease or the course of disease from progressing? And that may be our particular area of interest. So when we think about then where we're going to go, when we begin to identify that inkling of our interests, and we begin to go through some steps that will help us further bring some solidity to our research question. And so there is a mnemonic that you might use that helps you determine whether or not your question has some good characteristics that will enable you then to move forward into more fully defining and developing that question. So this mnemonic is FINER. Is the question feasible? Is it interesting? Is it novel? Is it ethical? And is it relevant? And then again, always remember that our goal is not to repeat research that has been done. It is to find new areas and new questions, new knowledge that we will bring to the universe. So if we're looking at feasibility, this is, I think, probably one of the biggest hurdles that an investigator will have. And that is having a very realistic discussion about resources. Do I have the resources that I need in order to move forward with my research idea? It may be, do I have the resources in terms of the personnel that I'm going to need to perform the study? Are there other material resources? Do I have laboratory equipment, or do I have a location to bring people together, whether it's patients or other collaborators? Or do I have the financial resources that I would need in order to put my idea into practice? If these are lacking, then that really is where the investigator needs to do at least a hard pause, if not a hard stop. Then is the question interesting? And this is not only interesting to you, but is there a societal interest to that question? Is the outcome of your research going to bring meaning? Is it going to be meaningful to a society? Is it novel? So does it really represent a gap in the knowledge? So considering what you are bringing that is going to be new to the knowledge universe. And then is it ethical? Does it have that clinical balance? We, as an example, clearly, if you are going to be doing a study, we're not going to be withholding a beneficial treatment just so we can see if it really works, that we are not going to be doing anything that will be harmful for a patient. So making sure that we have an ethical approach. And then is it relevant? Again, always passing that, so what? What difference does your work make? So again, making sure that it is realistic and that it is important. Now, I mentioned that the feasibility is one of the greatest challenges that you will have in developing not only your research question, but deciding whether or not you are going to be able to move forward. So it's really important that as a researcher that you pause and that you have a very open discussion with yourself. You may really want to do this project very badly. But if you don't have the resources, if it's not feasible, then it can end up being very difficult for you and difficult for those around you. So think about, as I'm beginning to think about how I might conduct this study, do I have enough time to do that? We talked about, starting a study that may require some years to actually be carried out. Are you going to have the time, both the length of time to devote to that study, as well as incrementally along that process? Do you have the time every week or every day to devote to that study? So clinical research is usually not something that's very easy to dabble in, that it's one of those situations where you really need to be all in, because it does take a significant amount of time, always more time than you think it will take. And you need to be able to devote appropriate time to that. Now, that's not only your time, but if you are conducting or considering a clinical study, then it's very difficult to do any of this alone. You have to have a team that is going to support you. So do you have enough personnel? Do they have enough time? Do you, is it clearly that people are not trying to juggle multiple responsibilities? So ensuring, again, the availability of the time as a critical resource. Also, do you have then the surrounding financial support? Do you have the equipment or supplies that are necessary? And it's important to have that commitment up front before you begin. That, oftentimes, we all believe in miracles, but I've learned during clinical research, they're very few and far between. So you have to develop your research question, and then how are you going to proceed living in the reality. If your research involves clinical subjects, do you have enough? Are there going to be enough subjects to actually help you answer your question? And if so, how are you going to identify them? How are you going to engage them in the research? So you can have a question that is very important to answer, but all the holes in the cheese haven't lined up at that particular point. And so feasibility may be a challenge. So you have to figure out, if I have a very important question that I need to ask, or that I feel is important for society and important for patient care, you have to think about how then you are going to construct that so you actually do have the resources. So you may have to scale down, or you may have to start parsing your question into multiple pieces so you can perform it. So let me give you just an example of an area that you may be interested in, and then how we might use the process to further refine a question. So clearly, I'm interested in infectious diseases. I clearly am interested in immunization. So this is one that's up my alley. So if I'm looking at patients that are 65 years of age and older, I want to know how well a particular vaccine performs in preventing a health condition. So I'm going to look at how well a vaccine X performs in preventing community-acquired pneumonia. So this is my research idea. So what steps do I need to take in order to refine that, get that into a format that I'm actually going to be able to perform a study that's going to give me some meaningful results? So what is missing, do you think, from this question? Well, we'll go on and we'll look at how then I can take that idea and begin to solidify that and give it some structure. So many of you have experience with that term of PICO. This is a format that we will use. Again, if you talk to a librarian, you're getting help with a literature review, many times the librarian will say, well, give me your information in PICO format. That's a clue to you that they need a little bit more information. You've got to kind of put a fence around how much information you're asking for them, give it a little bit more structure so the search process can be a little bit easier. So we'll go through what do each of these letters mean. So the P stands for the population. What is the population of interest? Who are you going to be including in your study? You may be looking at patients of a particular age or a gender, or those that live in a certain area or have had a particular experience in an area. So you're looking at some very specific characteristics of a group of people that will help you answer your research question. I then is the intervention that is being studied. You might also think of this as your predictor variable or your independent variable. This may include elements such as, how am I going to manage? What am I going to be doing as I am providing care? What type of diagnostic approaches am I going to be taking? What type of treatment or treatment strategies? What is it then, the intervention, the input that I'm going to be providing that is important for me to study? Then C is our comparator, our comparison group. It may be a patient that has had no intervention that we are going to be studying, or maybe these are patients that are receiving the routine or the standard of care, and I'm going to be looking at how their outcome might differ with respect to groups of this patient population who have received something other than standard of care. So again, this gives us that idea of what difference does our intervention make? So it helps us begin to answer the so what factor. O then is the outcome of interest, or the outcome variable. So this is the variable that determines the effect of the cause. So these are the patient consequences, relevant patient consequences to the particular intervention that we have included. T then is the time frame. So some of you may say, well, I've seen PICO, just PICO, and that's true that you may see PICO that doesn't include the time frame. But I think that as we develop our research study, we have to be very specific about what is going to be the time period of our particular study, so that we have a defined start and end period when we're looking at our patients that we will be including. So PICO is our population of interest, the intervention that we are going to study, the comparator group, the outcome that is of interest to us, and then the time frame of the study during which we will assess that particular outcome. So let's go back then to the question that we looked at earlier. The adult patients 65 years of age and older, that is our patient population. And then how effective was vaccine X? That is the intervention of interest, but we need to have a comparator. We need to know, well, what are we talking about? What is it going to be better than another intervention, or what our standard of care is? So vaccine X compared to vaccine Y, that is our intervention, or the I part of our PICO question. And then our outcome is preventing hospitalization due to community-acquired pneumonia. And our time frame is during the calendar year of 2021. So you can see, moving from our idea of looking at a particular vaccine and its relationship to a particular patient outcome requires a little bit more of additional information in order for us to get to a place where we can truly then study that. So again, we look at what our target population is, the large group. We pull out then through the refinement of our question, the population that we are going to study. And then we find the important question that we are actually able to answer through crafting then a structured approach in identifying the elements of the population. What is it that we are going to study? How are we going to know the benefit? And that is again through the comparator group. And then looking at our outcomes and our time frame. All of that then helps us craft then the type of question that we will be able to answer, or at least we can begin to take the steps toward answering. Again, the important issues are looking at our feasibility, and the importance of that question. So we've looked at sources of our question, characteristics of our question, and then how we can format our question to move forward with research. So with that, let me move on then to our next presenter.